So I'm going to check the medical record for size and location of the wound. I'm going to review the orders for the procedure. I'm going to gather all of my supplies. I am going to knock, introduce myself. Hi, my name is Angie. I'm going to be your student nurse today. Can you tell me your name and date of birth? They'll tell me Judy Smith, 10/2/1963. Judy, do you have any allergies? Yes to penicillin and strawberries. I'm here today to do your wound care. Do you have any questions? No? Are you sure you don't have any allergies to any cleaning products? No? While I do this procedure, I don't want you to touch the supplies that I'm using. On a scale from 0 to 10, what is your pain today? 7. I'm gonna go grab you some medication. This could hurt while I'm doing your wound care. I just wanna make sure that you're pre-medicated, and I'll come back in 30 to 60 minutes after the medication to make sure that we can do that. I'm going to perform hand hygiene. I'm going to prepare my equipment on the side that I'm going to do this so everything looks like it's set out nicely. I am going to make sure that the patient is draped adequately on the side that I need to do this. I am going to place the garbage bag within reach. It's right here. I am then going to apply my clean gloves. I'm going to remove the tape of the surrounding dressing, and I'm going to look at the gauze one layer at a time. So I'm taking off the pad first. I don't see anything. I'm placing it in the garbage bag. I'm taking the next one. I see some yellowish drainage. I'm gonna keep going. Just looking at each layer. All right, now I've gotten to the bottom of the wound. I'm looking on the inside of the wound to see the color. The color of this wound bed is red. I'm gonna assess for edema, so I'm gonna palpate around the outside. I don't feel that this is swollen, so there's no edema. When I was looking at my dressings as I was taking them out, I didn't see any exudates, no pus inside. I'm gonna look at the drainage. The drainage looks like it's a serous because it's bloody, sanguinous, and then serous because it's got this yellowish white or clear fluid. The amount of the drainage, I would say based on the amount of gauze, that this is moderate, maybe large amount of drainage. I'm gonna take my cotton tip applicator and I'm going to measure the wound. I'm gonna open it up. I take out my cotton tip applicator. I'm gonna first do the length, so I'm gonna start at the top of the wound. I'm gonna go to the bottom. I'm gonna take my wound measure. I'm gonna do it in centimeters. And this wound is 13.4 for length. I'm gonna go across for width. And I get 2.7. I'm gonna go in the middle for depth. And I get 3.1. All of this is garbage. Take this to the side. I'm gonna take off my gloves. I'm then going to look at my sterile package on my surface that I'm going to be using. I'm gonna make sure that it's not expired. I am going to make sure it's on a flat, dry surface. I am going to open this up with the flap away from me. I'm gonna pick up the syringe in the package, again, making sure it's not expired. I'm going to peel it without touching it. I'm gonna peel it away from myself and drop it inside the kit. I'm then gonna take my fluids. I'm gonna also make sure that they're not expired. I'm gonna take them at an acceptable height of 1 to 2 inches. I'm gonna pour some in the open area in the container. Place the lid back on. I'm not gonna cross over my sterile field. I'm gonna take my sterile gloves and open them up and put them on. I'm going to take my syringe. I'm going to put 2 to 3 mLs of saline in there, and I'm going to irrigate the wound. Now that this is dirty, I'm going to toss it to the side. I'm going to take a gauze. I'm going to place it in the wound and not on the outside skin. I'm gonna take a gauze on top, a gauze on the bottom, abdominal pad. Find the edge of the tape maybe. I'm gonna tape all 4 sides. I'm gonna take an additional piece of tape, date, time, and initial on the outside, and take off my gloves. Put new gloves on, get my patient into a comfortable position, hand the collet,